welcome my trailblazers. Another day at USCAP and another interview at USCAP. And I have fantastic guests again. One guest joined me for the previous interview.
Learn about the newest digital pathology trends in science and industry. Meet the most interesting people in the niche and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexandra Zhurov.
Robert Moody from Hamamatsu. How are you today, Robert?
I'm well, thank you.
And I have another guest from Agilent, Jake Eden. Hi, Jake. How are you today?
Hi, good, thank you.
So nice that you have joined me today because the topic of the conference is connections. And Agilent and Hamamatsu have a partnership. So in the previous interview, we talked about why are partnerships important, kind of more high level, how it happens, why now it's more important than before, why now it's happening more than before. But I would love to learn how it is like in the lab, day to day, in practice. But before we dive into it, let's start with you, Robert. A couple of words, what kind of expert you are at Hamamatsu for the trailblazers who don't know you yet?
Sure. Yeah, my name's Robert Moody, and I've been in the digital pathology world with various different organizations for about 15 years, closer to 20 maybe. And I currently manage partnerships for Hamamatsu Digital Pathology in North America.
Thank you so much, Jake.
I'm a global product manager for digital pathology at Agilent, so really working across our partnerships with Hamamatsu and others in the space.
Amazing. So good to have you here. So let's start with Hamamatsu representative Robert. What is valuable for the practical aspect of partnerships? And just one step back, Hamamatsu makes scanners. Agilent makes stainers. Anything else that you guys provide for the digital pathology workflow?
At Agilent, we have other partners across software as well.
But like your core expertise is
really in core pathology, so advanced staining.
So staining, we have scanning and staining. So obviously without staining, there is nothing to be scanned. When it comes to scanning from Hamamatsu perspective, what is important in a partner company or in a partner part of the workflow before it gets scanned?
It really takes two things. There's a commercial side of things and there's a technical side of things. Mm-hmm. Commercially, Agilent is a very large global organization that makes very high quality products. And so that's always a criteria we would look to. But the other thing is that they make, their staining is very consistent. Consistency is really important. And I think it's really what drives successful workflows.
Mm-hmm. Okay, consistency. High quality products, obviously being global helps, because if we want to deploy digital pathology globally, Jake, what does Agilent, what does matter for you across the workflow, in the digital pathology workflow?
When it comes to partnerships across digital pathology, I think it's really important to have a shared vision. So that was really kind of at the inception of the relationship with Hamamatsu, was a shared vision to deliver better answers to customers and ultimately their patients. Beyond that, I think the important thing is just, I'd say it's on the personal level, just building the relationships with the actual people between the organizations so that we're both contributing towards the value that's really created for the customers.
Mm-hmm. I think this is important to highlight. And we mentioned that in the previous episode, in the previous interview, that it used to start on paper. Now, actually, it starts with the people who are implementing from both ends, from various parts of the digital pathology workflow. So this is super important. I want to know, how do you coordinate that? Okay, you already found a partner, has high quality product, has good people, everybody is excited, you've shared the vision, but now it has to happen. How does it happen? Is there a sandbox to make it happen, or is it with a customer? Where do you start?
Do you want to start this one?
I can. It starts with really having everybody in the organizations that work together care. So you have to care about what you're delivering. Mm-hmm. And then it's really about the teamwork. It's hard work. I'm not going to lie. I spend more time with you and your team than I do with my colleagues. And I think that's important, right? It has to be commitment.
Mm-hmm. And Can you say where are you doing that?
Indeed. I mean, labs all across the U.S. are really where I'm focused. I know Jake works a lot in Europe as well, but we have a number of different customers that we go and visit together to make sure that things are running well and how we can duplicate that and how we can learn to make things better the next time around.
Mm-hmm. So basically both teams come and make it work.
Absolutely. So I think we go from the vision where we, agree to work together, and then, we agree on the shared endpoint as well. What do we really want to be able to deliver to our customers? Ultimately, for us, I think that's a single point of contact in digital pathology. It's removing the complexity, reducing this burden that's really placed on customers, I think, at the moment. And then working backwards from there, how do we make it happen? What processes do we need to get in place? What kind of touch points are there along the way?
So how does that happen? If you when a single point of contact, but you have not only two companies, it may be more partners. Is it like single point of contact per company? Is it like one person across the companies responsible for solution at the customers? Go as detailed as you can. I know you cannot say everything, but for a trailblazer that is looking into deploying digital pathology in a lab, they don't have infrastructure yet, they're just starting, how will it look for them?
So Agilent has been in the space of pathology for quite a while. We have this heritage within staining. So I think building on that relationship that we already have with the customer. So they're already used to coming to Agilent for their pathology needs. Mm-hmm. Based around that, we've really built this relationship with Hamamatsu in the background so that we can continue to be their point of contact. Because we work so closely with Hamamatsu, we can bring them in at the right times when it's appropriate. So bringing in their expert team throughout sales to consult the customer, to understand what their needs are really on a deep technical level. Mm-hmm. And then, throughout that kind of implementation process with the customer as well.
I mean, that's right. Agilent is the point of contact, and I and others at Hamamatsu support Agilent as agents of Agilent, really, to make sure that the customer gets what they need.
Is it? And that obviously makes sense from the order of the workflow. You stain first, and then you do whatever you want to do with the slides in digital pathology. You're going to be scanning them, and then they're going to be visualizing them and doing all the other things. So question or more of an observation, because you become the guide for the customer right now in how to make this work the best. How did this evolve? Did it, because in the previous episode, in the previous podcast, we talked, several labs did it at scale. We all jointly learned the lessons, but we know that in science, in healthcare, in medicine, spreading these lessons is not always that straightforward, and not everybody publishes everything. And also, if it's published, not everybody is reading these publications. So what I'm seeing right now, and what I love, is that the vendors are becoming digital pathology guides for the customers, for the labs, for the researchers. And tell me about how it changed since you started working, and how does it feel to be this guide? Because obviously you also have products, solutions, but you have the knowledge. And Robert, you mentioned that you were working for various organizations for 20 years in digital pathology. So tell me a little bit about that situation.
Sure. I think your original question was, how did this evolve to us being guides with partnerships? And I think it's out of necessity. Uh-huh. This was a survival. And what we've realized is the value that we bring through Agilent is more than just the sum total of the different components that they offer in the digital space. It's the guidance, the consultancy that we become to the customer. Mm-hmm. Most people go through a digital transformation once. Mm-hmm. We get the fun of doing it over and over and over again. And so we have the unique opportunity to learn and refine. And so that's really where the value comes from when working with a partner like Agilent, is that they've done this multiple times, and they can tell you how to accomplish your goals without you having to make some guesses.
Mm-hmm. And I assume it doesn't look the same for every lab?
No, one size does not fit all.
Unfortunately.
No. I would love for that to be the case. Then it would, it would be a single product that we would just, but no, integrations are different because labs are different. They're different geographically sometimes, right? We have hub and spoke models where you have a central lab and or central digitization, and then they have labs that are drawn out. But sometimes it's really just the way that they're working within the pathology group. Sometimes it's not even the hospital itself that's doing its own labs, it's outsourced. And so it's how you deliver that digital to the hospital from the reference lab is sometimes different. And then, of course, everybody has, even if they all use similar LIS systems, every deployment is unique. And so none of these deployments is exactly the same, but we've learned from each one of them to make the next one easier.
This is amazing. And this highlights also another aspect of connections. It's not just connections between partners, inter-company connections, like we talked yesterday or in the last episode, that headquarters of Hamamatsu is in Japan, and the most deployments of digital pathology are probably in the US, Europe. So there is also this global aspect of being connected, but also with your lab customers, with your clients, and a pretty connected partnership that is like three-way partnership that has to be, not actually, it is four-way or more way, because your clients or the people who your clients serve are also part of the equation. So very timely for the topic of USCAP connections. So I'm super happy that you guys connected, not this year. We already mentioned the video that we did 2 years ago. I'm going to link to this video where at USCAP in Baltimore, there was a display where Hamamatsu and Agilent were part of the workflow together. Is it difficult to coordinate?
Between us? Not really. We're talking about connections, and so I'll tell you some of what we've become very...
Difficult at the beginning?
Difficult, no. Every company has their own culture and their own language, and so I don't think that was difficult to overcome, but there was learnings.
Mm-hmm.
But I think the connections that can be difficult are, and we've learned how to help as consultants, help our customers navigate through the connections within their own organizations. You've got info security, IT, legal, finance, lab. And so understanding how one is going to respond to this differently than the other is a big part of the value that we bring.
Mm-hmm. Yeah, and this is an important point as well that I want to highlight, that digital pathology was never like one department show, even though it's called pathology, right? So it's going to sit in the pathology department, and that's where it's going to be used. But it's going to be the engineers, the IT, InfoSec, all the databases, and a lot more than that in an organization. So to connect that and to have all these people at the table from the very beginning, including people in the lab, including the staining component. And Jake, before we wrap up and I ask you about the takeaways, I want to ask you, for example, because you have that are not yet thinking about digital, but probably from your experience, at some point they will be, or there's going to be a necessity for that. Like, is there anything you guys like guide them on to be digitally ready when they are ready? Is there anything like that, or is it just like awareness, asking these questions? Like, do you have this conversation before the labs ask you about a partner for digital pathology?
Yeah, I mean, I couldn't distill it down to any one thing. Mm-hmm. I think the biggest recommendation would to be, I think of it in a future-proof way, right? You don't want to be limited. You want to keep your options open moving forward as well. So by selecting, ideally partnerships with us, but any products that will allow them that choice in the future, right? Looking for open agnostic workflows as opposed to something that's really going to restrict where they can go over time.
Mm-hmm. I think this is crucial because not everybody is going to be ready to go digital at the same time. But it is coming. It is being adopted more and more. It has tremendous benefits. And like not having to say no, and then like when they say yes, change everything, but rather saying not yet, but let's be ready for when we're ready. We have the means. We need it. We must do it. So that's also like leaving this part open to connect when the readiness is there is super important. Any important takeaways for the digital pathology trailblazers?
I think
the interview and for the conference, maybe some like...
Well, for digital pathology, I want to echo what Jake said and how important it is to future-proof things. We've seen a number of accounts that we've worked with have decided to take sort of small phase-wise approaches, and they didn't build in the ability to scale. And so you end up having to do it over. And the most expensive thing you can do is the same thing twice. And so a lot of what we do is try to guide people away from making that mistake.
That is amazing. Jake, any highlights, any insights, any takeaways for the digital pathology trailblazers?
Many. I'd say, just don't underestimate the value of a strong partnership in this space. It really comes down to I think the relationships and the support that you get from these partners as you go along this journey. It's really a journey. It's a huge undertaking to become digital. But if you have the right partners, then I think it can be made a lot easier, at least.
Listen, and I bet you guys are going to be connecting during this conference. If the trailblazers want to talk to you, where can they find you? I know where they can find you, Rob, because I'm going to be working with you at the conference. It's booth 312. Jake, if somebody wanted to talk to you about partnerships, about what you guys do and how you help labs be future-proofed, where can they find you?
Come down to the Agilent booth, number 123 at USCAP. We'll be there with our team of digital pathology experts ready to talk to you.
Fantastic. Thank you so much for joining me. I hope you have a great conference. If you're at USCAP, you're going to be seeing us hanging out there. Visit us, ask questions, don't be intimidated. And thank you so much again.
Thank you.
Thank you.
And I talk to you in the next episode.